Very good afternoon to one and all present here. And the next session which is going to start is the PG quiz final, state conference PG quiz final. Totally 36 members participated, the top 6 selected for the final rounds. So I'll announce the top 6 team, then they should come on the stage. Yeah. The first team, Team Asphyxia Analyst, KAP Government Medical College, Trichy. I welcome Dr. G. Muthukumar and Dr. K. Seguva Raja. Okay. Yeah, okay. Next, Team 2, Cyanide Circle, SRM Medical College, Chennai. I welcome Dr. S. Sandhya Priyadarshini and Dr. S. Aishwarya. Team 3, Death Diagnostician, Sri Ramachandra Medical College, Chennai. I welcome Dr. Nivyarini and Dr. Ashik. Team 4, Hemorrhagic Hustlers, Government Mogan Kumaramangalam Medical College, Salem. I welcome Dr. A. Kavya Tendral and Dr. L. Gopi. And Team 5, Lividity League, Government Coimbatore Medical College. I welcome Dr. L. Pavitra and Dr. Gautam R. And Team 6, Medico-Legal Mavericks, Government Kumaramangalam Medical College, Salem, Dr. K.K. Saravanamurthy and Dr. R.J. Yarini. Quizmasters for this final round, Dr. R. Narendra sir and Dr. Gopinath sir and Dr. Uday Banu. Thank you.
Very good afternoon to one and all. And we'll start the PG quiz. There will be 8 rounds. Round 1 will be Sherlock unlocks. Round 2 will be connections. Round 3 will be toxic spills. Round 4 will be spell B. Round 5 will be histomania. Round 6 is dumb charades. Round 7 is gain or pain, challenging round. Round 8 is rapid fire. As usual, it's rapid fire. All the best to all the teams. Okay, dumb charades irukku, spell B irukku, connections irukku, ஜாலியாவும் இருக்கும். அதனால என்ஜாய் பண்ணியும் பண்ணலாம். டஃப்பான கொஸ்டின்ஸும் இருக்கு. ப்ரிலிம்ஸ் பார்த்துருப்பீங்க. ஃபில்டர் அவுட் பண்ணுறதுக்கு வேறு வழியில் கொஞ்சம் டஃப்பாக தான் எடுத்தாகணும். பட் இட் வில் பி ஈஸியர் தென் த ப்ரிலிம்ஸ். We assure you that. We 3 assure you that. Okay, it will be so easy. டென்ஷன் ஆகாமல் 2 பேர் இருக்கீங்க. அதனால் யாராவது ஒருத்தர் மைக்கை ஹேண்டில் பண்ண பாருங்கள். ஒருத்தர் அந்த குறிப்பிட்ட டைமுக்குள்ளே டிஸ்கஸ் பண்ணிவிட்டு ஒருத்தர் மட்டும் ஆன்சர் சொல்ல பாருங்கள். 2 பேரும் ஃபம்பிள் ஆகி ஏதாவது மிஸ் ஆகிடக்கூடாது. சரிங்களா? பிகாஸ் சில ரவுண்ட்ஸில் நெகட்டிவ் மார்க்ஸ் இருக்குது. And we'll see, okay, how it goes. All the best to all the teams. And first 3 rounds will be taken by Dr. Gopi sir. Over to you, Gopi sir.
So the first round is going to be Sherlock unlocks. So first என்னென்ன ரூல்ஸ்னு சொல்லி பார்த்துடலாம். இதில் வந்து பார்த்தீங்கன்னா உங்களுக்கு set of images will be shown on the screen. So ஒரு டீம் வந்து you have to select an image. அந்த இமேஜ் செலக்ட் பண்ணீங்க அப்படின்னா அதிலிருந்து உங்களுக்கு வந்து 4 image clues வரும். ஓகே, ரேண்டமாக வந்து இருக்கும். ஸோ யூ கேன் செலக்ட் அன் ஆப்ஷன். ஸோ அதை செலக்ட் பண்ணதுக்கு அப்புறமா 4 image clues வரும். அந்த 4 image clueஸையும் பேஸ் பண்ணி அது என்ன கேஸ் அப்படின்னு சொல்லிட்டு நீங்கள் கண்டுபிடிக்கணும். ஓகேவா? ஸோ தட் இஸ் தி ஃபர்ஸ்ட் ரவுண்ட் Sherlock unlocks. இதோட பாயிண்ட்ஸ் வந்து பார்த்தீங்க அப்படின்னா 30 points. If you answer correctly அப்படின்னா 30 points will be given to each team. And also ராங் ஆன்சர் பண்ணீங்க அப்படின்னா -10 points நெகட்டிவ் மார்க்கிங்ஸ் இருக்கு. இதில் வந்து பாஸ் இருக்கும். கொஷின் வில் பி பாஸ் டு அதர் டீம்ஸ். அந்த பாஸ் பண்ண டீம் வந்து கரெக்டாக கண்டுபிடிச்சிட்டிங்க அப்படின்னா அவங்களுக்கு 15 points. ஓகே, ஸோ தீஸ் ஆர் தி ரூல்ஸ். ஸோ கரெக்டாக ஆன்சர் பண்ணுறதுக்கு ட்ரை பண்ணுங்கள். ஸோ இந்த ரவுண்டில் வந்து பார்த்தீங்கன்னா நம்ம ஆஸ்ஃபிக்ஸியா அனலிஸ்ட் தான் நம்பர் 1 எடுத்திருக்காங்க. ஸோ we are going to begin from our asphyxia analyst. Okay. So now the images can be displayed. ஸோ ஃபர்ஸ்ட் நம்பர் 1 வந்து பார்த்தீங்க அப்படின்னா பெரிய கோயில், தஞ்சாவூர் பெரிய கோயில். நம்பர் 2ல இருக்கிறது வந்து பார்த்தீங்கன்னா கங்கை கொண்ட சோழபுரம். ஸோ தஞ்சாவூரில் நடக்கிறனால தஞ்சாவூரோட ஸ்பெஷாலிட்டிஸ் என்ன அப்படின்னு சொல்லி தெரிஞ்சுக்கோங்க. ஸோ அது வந்து பார்த்தீங்கன்னா பேலஸ், ஓல்டு பெல் டவர், மியூசியம், அதுக்கப்புறம் பார்த்தீங்கன்னா தமிழ் யூனிவர்சிட்டி, தென் புன்னைநல்லூர் மாரியம்மன் கோயில். அது அடுத்து வந்துட்டு ராஜராஜ சோழன் மணிமண்டபம். ஸோ யூ ஆர் கோயிங் டு செலக்ட் ஒன் ஆஃப் த இமேஜ் நவ். ஸோ யூ கேன் ஸ்டார்ட் சூசிங் யுவர் இமேஜ். நீங்கள் எது செலக்ட் பண்ண போகிறீங்க இப்போ?
இதில் வந்து கொஸ்டின் கேட்பீங்க. ஆமாம் ஆமாம், ஏதாவது இமேஜ்
நீங்கள் எது என்ன சூஸ் பண்ணுறீங்க? Number 1. So they have chosen the big temple. Okay. Number 1. So based on these image clues, you have to find out the case. Your time starts now. So
Arnashenbach.
correct answer. 30 points. So you can see here, the first image is the Arna Shanbag. So you all know what happened to her. She was in vegetative state. So this case initiated the debate on euthanasia. Okay. So this is Arna Shanbag case. Next, to home button. So next, that is okay. So you choose one. 7. Okay. So number 7. So based on these images, you have to find out the case. Your time starts now.
We know it is cannibalism, but we don't know the case name.
And try the question will be passed to the other.
Pass to the past.
Pass. So the question has been passed to the other team. Wait, I'll do it. So anyone else? So anyone else wish to answer? Any idea? Okay. So then I will explain these images. The person shown here is the Jeffrey Dahmer. Okay. So he committed a series of murders. Nearly 17 young boys and men were murdered. So based on this case, there was a Netflix series also. This is a Milwaukee murder case, necrophilia and cannibalism. So that Milwaukee Tools is a famous hardware company. Okay, they produce power tools. We will move on to the home button now. So no points for this question. And no negative markings because they haven't answered. Okay. So next team, what is your choice?
5.
Huh? 5. Okay, 5. You can start answering. Your time starts now.
American minigun revolver.
Don't know, sir.
Okay, you don't know. Time's up. Anyone next pass to the other team? Anyone else want to answer?
John F. Kennedy.
Wrong answer. Only one option will only one time you can answer. Okay. Do you want to answer? No. Okay. So no negative markings for this team because the question has been passed to this team. Okay. Right. பாஸ் பண்ணால் நெகட்டிவ் கிடையாது. பாஸ் இன் சென்ஸ் பாஸ் பண்ண டீம்ஸ் ஆன்சர் பண்ணலாம். அவங்களுக்கு பாஸ் பண்ண டீமுக்கு நெகட்டிவ் மார்க்கிங்ஸ் வராது. இல்லை அதுதான் அவங்க சொன்னாங்க. ராங் ஆன்சர். ஓகே. ஸோ ஐ வில் ரிவீல் ஆன்சர் நவ். ஸோ திஸ் இஸ் தி அசாசினேஷன் ஆஃப் ஆப்ரஹாம் லிங்கன். ஓகே. Because the first image shown here is the Lincoln Memorial. The second picture shown here is the Lincoln Tomb. and the third picture is the White House. You all know that. So obviously it is a US president. So the last image is the Derringer, so which was used to murder or assassinate Abraham Lincoln. Home button, please. Okay. So you can choose your number 2. Okay, your time starts now. You can start guessing. Okay, so the image shown in this picture is the revolver Arminus .32. So this image was used as a murder weapon, this weapon, and here you can see the bullets in the skull, which was identified by the second postmortem actually. So this is the famous Tandoor murder case. Okay, so in this case she was chopped into pieces and was put in a tandoor stove by her husband. So the police found out some mystery smoke coming out at late night. So they went there, they found the body, and then what happened was the first autopsy, the cause of death was given as shock and hemorrhage, like because of the cut wounds only she died. But later on re-postmortem was done. X-ray was not taken, PM X-ray was not taken in the first postmortem. Second postmortem PM X-ray was taken and the bullets were found. Home button, please. So, 4. So your time starts now. Come on, guys. So time's up. The question is passed to the next team. You want to answer?
So negative mark lalla.
Negative mark.
Acid attack on Shanti.
Sorry, you have to say the name of case. Don't know.
Lakshmi Agarwal, vitriol edge case.
That's the correct answer. Bonus 15 points for this team. So the first photo is the photo of Lakshmi Agarwal before the acid attack. So Deepika Padukone, the second picture, she acted in a movie called Chapak based on this true story. Then you know acidic fruits and acid litmus test. Okay. 6. Okay. So number 6. Your time starts now. So time's up. The question is passed to the next team. Do you wish to answer? Okay. Anyone? Do you want to answer? Anyone from the audience? Anyone from the audience? If you know the answer, you can answer. Answer one.
Shakespeare murderer.
That's wrong. Actually, this is the case of chocolate cream killer. Chocolate cream killer. So this is Christian Edmonds. So in the story வந்து பாத்தீங்கன்னா இவர் பக்கத்து வீட்ல இருக்க டாக்டர் இந்த லேடி லவ் பண்ணுவாங்க. Doctor is already married. So she wanted to murder the wife of the doctor. So she started poisoning. She used chocolate creams. She laced it with strychnine. And she delivered it to the entire town because it should not be suspicious like that. So she delivered it to the entire town. So this is chocolate cream killer case. Home button, please. So with this, we have completed this round. Sherlock unlocks. All the best to the teams and congratulations for the points. Okay, right. So we will take a short break now. So meanwhile, we will calculate the scores and display it, and we will move on to the next round. Okay, so we will move on to the next round now. The next round is connections. So I will explain the rules. So here also you have to select an image from the images shown here, and 4 image clues will be displayed. 4 image display agum. So we have a common connection. You will be having a common connection between those 4 images. So you have to find the correct answer. Okay. So for this, again, for correct answer, 30 points will be given. If you answer incorrectly, minus 10 points. Okay. Negative marking is there. It will be passed to the other teams. If they answer correctly, 15 points will be given. When the question is passed, there will be no negative mark for the other teams. Okay? Right. Shall we move on to the round? Okay. So we are going to start from hemorrhagic hustlers. They are going to choose now. 7. So they have chosen 7. Number 7. So your time starts now. You can start.
RH if you RH incompatibility.
Wrong answer. Wrong answer. Only one option for you. No, minus 10 points for you. The question is passed to the next team. You want to answer? We will move on to the asphyxia analyst. They are analyzing. Okay. Answer. Do you want to answer? You should answer. Okay. So the question is passed to the audience now. Anyone interested? Willing to answer this question? Okay. We will move on to the answer now. So it is fetal abstinence syndrome. Okay. The first image shows pregnancy, second image shows IV injection. Okay. Drug abuse. And that is the fetoplacental barrier, fetus. So next is the newborn baby. So she'll be developing, the baby will be developing after birth abstinence symptoms. Right. So this is neonatal abstinence syndrome. So home button. So next, no, update.
6.
Number 6. Number 6. So your time starts now. So time is running. Come on. Okay, time's up. The question is passed to the next team. You want to answer? No. Okay. Want to answer? Question you got to answer. You don't want to answer. Want to answer? Okay, anyone from the audience? Anyone from the audience? Do you wish to answer this question? Okay, so I will explain the answer now. So first, that is a sparrow. Okay. Next is the crow. That is a bird. So next is the buck. Next is the boar. So these are types of shotgun pellets. Bird shot, dust shot or sparrow shot, buck shot, and then slug. Okay. Right. Okay. So the next team is going to choose.
Sir, 5 sir.
5.
Lot number 5 sir.
Then the order.
8 sir.
8. Number 8. So your time starts now. So anyone wish to answer? Okay. So time's up. The question will be passed to the next team. So they will be getting the chance now.
Punch drunk syndrome. Punch drunk syndrome.
So it is punch drunk syndrome or chronic traumatic encephalopathy. Okay. So the first image shows Bennett Omalu. So the Dr. Bennett Omalu, he diagnosed it first, chronic traumatic encephalopathy, after the death of an American football player. Okay. So next is the boxer. This is also known as boxer syndrome, and also Will Smith has acted on a movie based on this CTE. So we'll move on to the home button. Okay. Number 5. Number 5. So wait. So based on these colors, on the basis of Birth and Death Registration Act, color codings are given to various forms, from form 1 to form 4. So you have to order it in a correct sequence within 30 seconds. You understand? So these are color coding forms for birth forms, etc. Okay, death forms, birth and death forms. Okay, these are color codings. You have to order it within 30 seconds, the correct sequential order. Okay, your time starts now. You have to explain what form it is. What color code in a form so. Okay. Because you should not guess. So you cannot guess. You have to explain the color code of the form also. Okay. No. Question to the audience. What is form 1? So you'll display the answer now. Okay. So D, that is pink form, that is for birth report form. And yellow form you all know, death report form. And the blue stands for stillbirth form. And white is the our regular MCCD form, form 4. Okay. So home button. One. Okay. Number 1. So based on these images, you have to answer. Your time starts now. Time's up, time's up, time's up. Do you wish to answer? It will be in this order. Question will be passed in this order. Okay? Time's up, time's up. Time's over. Okay? Pass. No, you want to answer? Pass. You wish to answer? Pass. Okay, you wish to answer? What? No, wrong answer.
Good or evil test, wild beast test, irresistible, McNaughton.
So this is test for insanity, okay? This is test for insanity, that is good or evil test. Wild beast. So it is known as wild beast in Dutch. So this animal's name is wild beast. Basically it means wild beast, okay? So next is the impulse. Irresistible impulse test, and that is a photo of the McNaughton. Move on to home button now. So next team, number, which can select it. Which question you are going to answer? 7. So number 7. 7 already they have told. 8 over. 3. Number 3. So your time starts now. Mic. Use the mic to answer. Use the mic to answer. Okay. So time's up. The question is passed to the next team.
So speedballs.
Correct answer. Speedball is the correct answer. Okay. The first image shows cocaine, and the second image is the opium. Okay. Heroin is derived from that, and Flash is known for his speed, and that is a ball, football. We will move on to the home button. Everyone has answered. Ellarum answer pannittingala. Okay. So this round is complete now. So we will calculate the scores. We will take a short break and then we will move on to the next round. Toxic spills. So I will explain the rules for this round. So you have to again choose an image. Image clues will be displayed one by one. Okay. Image clues will be displayed one by one. Totally there will be 4 image clues. So if you answer correctly in the first clue itself, you will get 40 points. Okay. If you answer it in the second clue, you will get 30 points. If you answer it in the third clue, you will get 20 points. In fourth clue, 10 points. There is no negative markings for this round. Okay. So the question will be passed to the other teams once all the 4 clues are displayed. So if the other teams answer correctly, they will get 10 points. Okay. Right. No negative markings for this round. We will start. So we will start from the team Liberty League from Coimbatore. So you can select your image.
Second, 2.
So they have chosen number 2. So first clue, please. You want to answer?
Second.
I request the audience not to answer, please. Audience sound will be scaled separately.
Second clue.
You want to answer?
Second clue.
So next clue. You want to answer now?
Rice sardonicus stretching.
Move to the next clue. So next clue, please. You want to answer or you want to see the next clue? Time's running, pa. So next clue, please. Do you want?
Stretchness noxomic.
Yes. Correct answer. You can display the answer now. Strictness. So you cannot guess the answer from the first clue because all clues will be related only. So if you are sure, you can guess because there is no negative marking in this round. If you are sure, you can guess. Okay? Right. So home button. We'll move to the next team.
3, sir.
3. Number 3. First clue, please. Next clue. Next clue. Final clue, please. You wish to answer now? You can answer only once. If 4 clues are displayed, you can answer only once, okay? You can try because there is no negative marking, okay? Okay. They have passed the question.
Snake biter.
Correct answer. To be particular, do you want to be particular?
Hemotoxic in
Correct answer. Correct answer. Okay. So the first image is the intercompartmental pressure monitor. This image is given in our textbook. Okay. So next is the microvascular thrombosis, which will be seen in Russell Viper envenomation, hematemesis, and clotting time. Okay. Tube method. Okay. Home button, please. One. Okay. Number one. First clue, please. Next clue. Next clue. You can answer only.
Then next clue.
Next clue, please.
Negative mark.
Negative mark. But you can answer only once. And guess once. No negative marking.
Blue stiffening.
Correct answer. Glue sniffing. So this is a volatile substance abuse. Okay. So home button. என்ன choose பண்றீங்க round 4. Number 4. First clue, please. First clue. Next clue. Next clue. Do you want me to display the final clue? Do you want me to display the final clue? Okay, final clue, please. Now, can you identify? Do you want to answer? Time is running. Do you want to answer? No. Pass. Okay. The question is passed to the next team. Negative points. No negative points in this round. You can answer, but you can answer only once.
Puffer fish poisoning, sir. Tetrodotoxin. Tetrodotoxin poison.
Correct answer. Tetrodotoxin. So all these aquatic animals and salamander. The first image is the salamander. The second one is the horseshoe crab. Okay, horseshoe crab, and this is the blue ring octopus. So they have the common toxin, tetrodotoxin. Okay, right. Home button, please. Number 7. Number 7. First clue. Second clue. You wish to answer? You want to see the next clue or you wish to answer? Next clue.
Hemlock. Conium.
Okay. Conium maculatum. That is the correct answer. 20 minutes. So the image shown here first is the neuromuscular junction. So that is the conium maculatum flowers, and that is the stem of the conium maculatum. There you can see the purplish spots. So that is known as blood of Socrates. So Socrates was killed using this poison. Okay. Right. So we'll move to the home button now. So we'll get a choice. 5. Number 5. So first clue. Do you wish to answer? Or you want the second clue? Second clue. Do you wish to answer? So okay. Next clue. Do you want to answer now? Do you wish to answer now? Or shall we see the final clue? Final clue, please.
Sir, arsenic poison.
Wrong answer. The question is passed to the next team. You wish to answer? Wish to answer? You wish to answer or not?
Sir, oxidation poison.
Wrong answer.
Lead poisoning.
Wrong answer. Anyone? Sorry. No. You have to, based on all the clues only you have to answer, not based on a single clue. Okay, right. So the first image shown here, we will move on to the answer now. Or anyone from the audience, you wish to answer? No? Okay, we will move on to the answer now. It's very easy question actually. Malady-dengue bodies, triple M, Munish beer heart, that is dilated cardiomyopathy, malady-dengue bodies, malady-wise tears, that is esophageal tear, and that is the wrist drop, okay, Saturday night palsy, okay. Right, we will move on to home button now. Oh, okay, that is dilated cardiomyopathy, yeah. Munish beer heart. Okay, home button.
Okay. Spell B round. Spell B. Coming to the rules. One from the team has to come and spell out the FMT term. You have to spell it out. Okay. If spell correct, plus 20 points. If spell wrong, minus 5 points. ஏன்னா ஸ்பெல்லிங்லேயே நம்ம எஃப்எம்ல தப்பு பண்ணிடக்கூடாது, அதனால் மைனஸும் இருக்குது. ஓகே, அதனால் இது முக்கியமான ரவுண்ட். தேர்ஃபோர் ப்ளஸ் ஆர் மைனஸ் ஏதோ ஒன்று கிடைக்க தான் போகுது. யூ வில் ஹேவ் ஆல்ரெடி உங்களுக்கு லாட்ஸ் கொடுத்தாச்சு. வில் ஸ்டார்ட் வித் டீம் ஏ, ஆட்டோப்சி அனலிஸ்ட். ஆமாம், நீங்கள் தான் இல்லை உங்களுக்கு அந்த என்ன வந்திருக்கு, என்ன லாட் நம்பர் வந்திருக்கு? வாட்? 7. ஓகே, சொன்னதுக்கப்புறமா யூ டேக் 30 seconds. ஃபார் ஈச் டீம் ஐ வில் கிவ் யூ 30 seconds. இஃப் ஒன் டேர்ம் இஸ் told to you, you can write your term. ஸ்பெல்லிங் கரெக்டாக இருக்கான்னு நீங்கள் செக் பண்ணி பார்த்துக்குங்க, சரியா? தென் ஒன் ஹேஸ் டு ஆன்சர், எனி ஒன் ஹேஸ் டு ஆன்சர் தட் ஸ்பெல்லிங். ஓகே,
இப்படியா இருந்தாலும் மார்க் ஒன்று ப்ளஸ்
சார்,
இப்படியா இருந்தாலும் மார்க் ஒன்று ப்ளஸ் இல்லைனா மைனஸ்.
கண்டிப்பாக ஒன்றும் இல்லை இருக்குது, அவ்வளோதான். ப்ளஸ் ஆர் மைனஸ். ஓகே, யுவர் லாட் நம்பர் சார் இப்போ என்ன வந்துச்சு? 7. Ophytoxemia. Time starts. After I told it, time starts. 30 seconds. You have a bell?
20 seconds more.
போதுமா? அவ்வளோ கவுண்ட் டவுன்லாம் வேணாம், 5 செகண்ட் தான் இருக்கு.
Five seconds.
Sir, time up, sir.
Time up.
Yeah, sir. Time up, sir. You can start it.
OPHITOXEMIA.
Okay. 20 points. 20 points. No pass. No pass or nothing. Okay வா, ஒரு டீமுக்கு ஒரு கொஸ்டின் மட்டும். Lot number 4. Are you ready? Pleurostotonus. I'm going to.
Seconds more.
Ready?
Time up. PLUROSTHO.
Slow.
P.
ஒவ்வொன்றா சொல்லுங்க.
PLUROSTHO TONUS.
Wrong answer. -5. PLEU. PLEU. Okay, E மட்டும் விட்டுட்டீங்க. Okay, E விட்டுட்டீங்க. Okay, -5. -5. Number 2. Okay. Timer. De-Clermont syndrome.
Sir?
De-Clermont syndrome. De-Clermont syndrome. டைம் இருக்கு, கொஞ்சம் யோசிச்சு சொல்லலாம். கஷ்டமா?
10 seconds more. Time up.
சொல்லுங்க.
DE
Yeah.
DECLERAMBAULTSYNDROME syndrome.
Correct answer. +20. +20. 9. Okay. Alcoholic palimpsest. Alcoholic palimpsest. Alcoholic palimpsest. தவாலி மாதிரி ஆகிட்டீங்க, 3 தடவை சொல்ல வருங்க.
Seconds. Time up.
Time up. Yeah. Time up. சொல்லுங்க.
சார் ALCOHHOLIC.
ஓகே, ஸ்லோவா சொல்லுங்க. தென்
PALIMSISTS.
-5. Wrong answer. SESTS. Cest. Okay. -5. Lot number. Lot number ma. 8. Formication. Formication. ரெடியா? டைம் இருக்கு. யா.
10 seconds more.
FORMICATION.
ஓகே, கரெக்ட். +20. Lot number 5. சொல்லட்டுமா? Palmas notation. Palmas notation. Palmas notation. டைம் இருக்கு.
10 seconds more.
டைம்ஸ் அப். ஓகே. சத்தமா சத்தமா மைக் ஆன்.
PALMARSNOTATION.
-5. MER. Okay. MER. Okay. -5. Okay. This ends this round 4 spell B.
So the next round is histomania. So pathology slides will be displayed, so you have to identify it correctly. Okay. If not the findings, at least you should say what it is. Okay, if you are not able to tell the findings also, but you have to identify it, condition. Okay, right. So the rules are: select any one from the images, a slide will be shown to you, identify it in 30 seconds. Time limit is 30 seconds for this, one question for one team. Okay, so no negative points for this round. Okay, we will move on to the lot now. So can display the images now. Right. So என்ன choose பண்றீங்க? மைக் ஓகே. அப்படியே பாஸ் பண்ணி பண்ணுங்க மைக். Switch on the mic. Mic switch on. Number 1. Number 1. So your time starts now. You can identify the condition. 30 seconds is running now. Mike. Thrombus. Yes, that's the correct answer. Correct answer. The answer can be displayed. Mike. So here you can see the image. So that is the artery. First you have to identify the vessel, which vessel it is, okay? Because thrombus formation will be there in artery. So there you can see the muscle layer which will be in arteries only. And also that is center portion is the arteriomatous plaque with thrombus formation, okay? Right. So we'll move on to the home button now. Okay. Mike. Which one? Number 5. Okay. Number 5. So you can start answering. Your time starts now.
Negri bodies.
No. Wrong answer. Okay. Okay.
Ashcroft bodies.
Time's up. Time's up. Okay, we will move on to the answer now. Mike. So this is the amoebic liver abscess, Mike. Amoebic liver abscess. So you can see the trophozoites, which within the trophozoites there you can see the RBCs here. So here you can see the RBCs. That is erythrophagocytosis. Okay, we will move on to the home button now. So which one you want to select? Number 2. Number 2, please. Your time starts now.
So there is a dissection. So aortic dissection, sir.
So aortic dissection, the correct answer. Correct answer. Aortic dissection it is. So here it is a large artery, large vessel, okay? In center you can see the lumen. So that is the intima, and between intima there is a dissection which extends into the media. Okay, so this is aortic dissection. Home button, please. Number 3. Number 3. Number 3. Can start answering. Time starts now.
Negri bodies.
Correct answer. Correct answer, Negri bodies, okay? So here you can see the neuronal cell. So this is the neuronal cell here. So within the neuronal cell, this is cytoplasm, and here is the inclusion body. So there is the intracytoplasmic inclusion body. Okay, so this Negri bodies. Okay. Okay, home button please.
ஏதோ ஒன்று எடுக்கலாம் ஷேர் ஓகே 7
So your time starts now. Time's running. Do you answer?
சொல்லியா
Entamoeba histolytica. Entamoeba histolytica.
No. Wrong answer. So time's up. So the correct answer is acute myocardial infarction. Okay, can you see here? So this is the myocardial fibers here. So this is the normal myocardial fiber and this is the infarct area. So there is a clear zone of demarcation. So this is the clear zone of demarcation. Neutrophilic infiltration with these reddish patchy areas are the hemorrhages. Home button. One. Number 1. Already taken. 4. So your time starts now. Time's running.
Emphysema.
Sorry, wrong answer.
Pulmonary edema.
Time is going to end.
Pulmonary edema.
No, wrong answer. So time's up. Okay. So answer please. So this is acute tubular necrosis. Acute tubular necrosis. Here you can see destruction of the tubules and also cytoplasmic breakdown and karyorexis. Okay. Right. So with this round ends. Next we will move on to the next round after calculation of this course. I'll hand over the mic to Dr. Narendran sir.
One from the team has to come and act, which has to be found out by the other team member. Time 60 seconds. 60 seconds will be there for acting. Acting கண்டுபிடிச்சி மொத்தமாக சொல்கிறதுக்கு 60 seconds. Actingக்கு 60 seconds, கண்டுபிடிக்க 60 seconds. Total 60 seconds. If answered correct, 20 points. If answered wrong, no negative marks. Pass will be there. Okay, pass questions will be there. Okay. சொல்லிடாதீங்க, don't spell it out. வாய் அசிட்டிங்கன்னா disqualified. Okay. No lip movements. Others, அவர் பண்ணுறதையும் நீங்கள் பார்க்கணும், வேறு வழி இல்லை. உங்களுக்கு பேக் சார் ஓ அது ரொம்ப இதாக இருக்கு என் பாவம். Yeah, okay. Time starts now. Mic, use the mic. Use the mic.
Mad. Cap.
Audience, please
Hat.
be silent.
Mad hat. Manhattan syndrome. Manhattan. Mad. Hat. Madoc. Mad hat. Mad hat first word. Rendu word.
Time.
Okay.
20 seconds more.
Mad hat என்ன பண்ணீங்க? இப்போ என்ன பண்ணீங்க? ஸ்லீப் தூங்குறதா?
10 seconds.
Hat தூங்குறதா? தூங்குறதா? Sickness.
Time up.
Time up. Okay. அடுத்த மார்க். ஓ, நடிச்சதுக்கு மார்க் வேணுமா? ஓகே, பாஸ் வேண்டாம் மேடம். ஏன்னா பாஸ் நோ பாஸ் பெட்டர் நோ பாஸ். ஓகே, ஈஸியாக தெரிஞ்சிடும். அதனால தான் ஃபஸ்ட்டு பாஸ் வேணாம்னு நினச்சோம். ஆன்சர் இஸ் மேட் ஹேட்டர் டிசீஸ். மேட் சொன்னீங்க, ஹேட் சொன்னீங்க, மேட் ஹேட்டர் அவர் நல்லா நடித்தார், நல்லா சொன்னீங்க. டிசீஸ் இப்படிலாம் சொன்னார், பண்ணியிருக்கலாம். மேட் ஹேட்டர் டிசீஸ். ஹூ இஸ் கோயிங் டு ஆக்ட்? கம் இன் ஃப்ரண்ட். மேடம் இல்லை நம்ம இப்படி தான் எடுத்துகிட்டு வரோம். இல்லை எஃப்லேருந்து இப்படி எடுத்துகிட்டு பின்னாடி காமிச்சிட்டாரு. ஓகே, டைம் ஸ்டார்ட்ஸ் நவ்.
ரெண்டு டாக்ஸிகாலஜி. சொல்லுங்க. ரெண்டு வேர்ட். செகண்ட் வேர்ட் ஹார்ட்டு, கார்டியாக், ரப்சர், மசில், பாய்சன்.
நீங்கள் ஏதாவது சொல்லுங்கள், கமான்.
பாய்சன் ஃபர்ஸ்ட் வேர்ட்.
30 seconds more.
ஆல்கஹால், சாப்பாடு, எடுத்து சாப்பிட்றது. ஹார்ட்டு. ஃபுட்டு.
10 seconds more.
ஃபுட், ஸ்நாக்ஸு, ட்ரிங்க்கு, ஜூஸ்.
Time up.
Time up. Okay.
கெஃபே கொரோனரி.
அவ்வளோதான், முடிஞ்சு போச்சு. கேஃபே கொரோனரி. ஓகே, கேஃபே கொரோனரி. ஓகே, தட்ஸ் த ஆன்சர். ஓகே. அவருக்கு காமிச்சிரு. ஓகே, டைம் ஸ்டார்ட்ஸ் நவ். Mics.
Alcoholic. Burger. Burger. Hut.
30 seconds more.
Burger. Tea.
10 seconds more. Time up.
அடிச்சா என்ன சைன் வரும்? கண்ணில் பார்க்கறது மெக்கிவன் சைன். மெக்கிவன் சைன். அடிச்சான்னு இல்லை, சம் பெயின்ஃபுல் ஸ்டிமுலை. அது மெக்டொனால்டு. அப்படி இப்படி வா, இப்படி கம் திஸ் சைட். ஓகே, ரெடி? யா, டைம் ஸ்டார்ட்ஸ் நவ். எத்தனை வேர்டு? சொல்லுங்க ஏதாவது.
சிஎன்எஸ். சைக்கோ.
நோ லிப் மூமெண்ட்ஸ்.
Gate. Okay.
30 seconds more.
Psychiat. Okay. Psychiat. Psychosis.
No lip movements.
10 seconds more.
First psychosis.
Time up.
அவங்க நல்லா பண்ணாங்க. எனிபடி ஆன்சர் ஏதாவது? லூசிட் இன்டர்வல். என்னது? ஓகே, லூசிட் இன்டர்வல். இப்படி வாங்க.
First word.
Time starts.
I. Train. I. Rail. I. Train. Rail track. Rail track on the operation. Cap. Cobram. First word. 5 letters. First
30
letter,
seconds.
last letter. Small, short. நம்ம 5 பேரில் காதம்பரி. காது. கா. கா. சீக்கிரம். காட்டிங்.
10 seconds more.
காட்வே டிசீஸ் தலையெழுத்த தா காது காத்தா.
Time up.
Time up. Anybody? Another sign? Kevokian sign. Kevokian sign. Okay. Hey, last one. Easy.
Okay. Cocaine. Cocaine,
Audience,
bugs,
please.
formication.
நான் சொன்ன வார்த்தை வரும். No lip movement. Audience, please.
Cocaine. Cocaine.
30 seconds more.
Cocaine bugs.
Yeah, correct answer.
So the scores so far will be displayed. So these are the scores now. So asphyxia analyst 20 points in this round, and the other teams haven't scored in this round. So scores so far from the first round to till now: asphyxia analyst leading the table with 135 points. Superb work, guys. And cyanide circle, they have scored 25 points. Death diagnosticians at the third place now with 50 points. Hemorrhagic hustlers 30 points. Lividity League 60 points. And medico legal mavericks with 10 points. Okay, so these are the rules of this round. One team can challenge the other team for their points. Okay, the challenging team has to select any one from the images shown. An image clue or flashcard will be displayed. Time limit is 30 seconds for this round. For correct answer, plus 25 points for the answering team and minus 25 points for the challenging team. You understand? If the answering team answers correctly, answering team will be getting 25 points, but the challenging team will lose their points, minus 25 points. And for wrong answer, the challenging team will get plus 25 points and the answering team minus 25 points. You understand? Okay, shall we start the round? Okay, whom you are going to challenge? Team 2. They are challenging them. Okay. Which image you are going to choose? Number 6. Number 6. So your time starts now. Time's running.
அது என்னது டொர்ஹாம்ஸ் ரூல் அந்த மாதிரி ஏதாவதா நேற்று கூட டொர்ஹாம்ஸ் அது என்ன கேப்னே தெரியல பல் வாட் பி ஹேவ் டு
If you don't answer also, you will lose your points because this is challenge round, okay? Time's up. Time's up. Let's see what it is. Any idea? Any answers from the audience? No, not Gustafson's. No. These are okay. Answer, please. Boyd's method. Okay, these are incremental lines. These are incremental lines. You can see the teeth here. So dental and enamel. So they will be having these incremental lines, and there will be a disruption during the time of birth. So there will be a dark band. The darkest band is the neonatal line. So we have to calculate the incremental lines beyond that neonatal line to calculate the age. Okay, so that is his principle. Okay, home button please. So points minus 25 for team 2 and plus 25 for the challenging team. Are challenge பண்ண போறீங்க?
Challenge to team 3.
Team 3. So they have challenged team 3. Okay, what is your option? 8. Okay, option 8. So your time starts now. Time's running, time's running.
Photoluminescence test.
Sorry? Time's up, time's up, time's up.
UV luminescence.
Time's up. No, no. So anyone from the audience? Anyone from the audience?
Photoluminescence.
Hair? Hair fiber off? Okay, so this is a rabbit hair. Can display the answer now. So this is a rabbit hair. You can see corn pattern. Okay, that is a multi-serial pattern. In cat, if you see, there will be uniserial pattern. So this is multi-serial pattern, corn pattern. There are also other patterns like lattice, etc. Okay, right. So home button. Challenge. So no one is daring to challenge team 1, asphyxia analyst. Minus 20. Challenge பண்ண team க்கு plus 20. Answer பண்ணலைனா minus 20.
Sorry. 5 sir.
5. Team 5.
இதே சொல்லலாம்.
1 சொல்லியாச்சா?
1 எடுத்துறாங்களா சார்? 2 சார்.
2. Number 2. Your time starts now. Time is running. Only a few seconds. Answer.
Hemochromogen.
No, not. Time's up. Time's up. They were near actually. Can display the results. Can display the results. Sorry, answer pa. Takeman test. Hemin crystals. Okay. Hemochromogen. Hemin. Adu takayama. Okay. So home button please. Home button. நீங்க யார சேலஞ்ச் பண்ணுங்க?
அவங்க ரெண்டு பேர்ல ஒருத்தங்க தான் வச்சு டீம் 5.
Team 5. They are challenging team 5. So option in the choose option.
சொல்லுங்க தான். நீங்க முடிச்சிட்டீங்க. 4
4. நீங்க
ஏதோ ஒன்று சொல்லுங்க.
Number 1 na? Number 1 please. They are challenging team 4 actually. Number 1. Display number 1. Time starts now. Yes. Scromboid fish poisoning. Correct answer. Excellent. Correct answer. So this is anyone know the name of the fish? It's known as Bombay duck. Okay, Bombay duck poisoning. So histidine will be there. It will be converted into histamine. So when we consume the flesh, that means that is ichthyosarcotoxicosis. So it is a scromboid poisoning. Okay. Home button please. Yaar challenge me.
6.
Yeah, okay. Option team 6. They are challenging team 6. 7. They have chosen 7. Time starts now. Time's up. Anyone from the other teams you want to guess? But no marks will be given to you. If you want, you can guess. Huh? No. Anyone from the audience? Sir? Okay, so this is one of the type of frangible bullet. Okay, so it is known as glacier bullet. Glacier bullet because inside there will be only pellets. Inside the bullet there will be pellets, and the tip it will be covered by a short sponge ball or plastic ball. Okay, rubber ball or plastic ball. Okay, so this is known as glacier bullet. The advantage is we cannot trace the gun. Okay, home button. Last challenge பண்றீங்க. இல்லை ஏற்கனவே சேலஞ்ச் பண்ண டீம் பண்ணக்கூடாது. ஸோ அவங்க யாரும் முடிஞ்சிருக்காங்க. முடிஞ்சிச்சா 1 மட்டும்தான் இருக்காங்க. 1. Okay. So they have challenged the leaders. என்ன சூஸ் பண்ணுறீங்க? 7 எடுத்துட்டாங்க. 4. Number 4. So your time starts now.
Sir? Traffic about choking. That will be your
Time's up. So any other team you want to guess? Yeah, floppy baby syndrome. It is floppy baby syndrome. So it is caused by benzodiazepines. Okay, they have displayed the answer. So it is caused by also botulinum. Okay, also botulinum. It's caused by botulinum. Okay. Right. So this is floppy baby syndrome. Home button, please. எல்லாருமே சேலஞ்ச் பண்ணியாச்சு. 6 முடிஞ்சிச்சாங்க சார். ஓகே. So I think we have completed the round. So we will calculate the scores and we will see the results, and also one more round is the
இந்த ரவுண்டோட ஸ்கோர் டோட்டல் ஸ்கோர்ஸ் இஸ் 85 ஃபார் டீம் ஏ autopsy analyst, டீம் பி 25, டீம் சி 50 and team 4 80, team 5 Liberty League 60 and team 6 10 points. ஓகே, வின் பண்ணுறதுக்கு நிறைய சான்ஸ் இருக்குது. ஓகே, வின் பண்ண முடியும் யாருனாலையுமே. ஓகே, shall we start it? You have answered.
Sir, red line of demarcation.
No. -10. Can go back to any of the questions. You can go back to any of the questions. Which you want to answer?
20 seconds more.
20 seconds more. Which you want to answer?
Semi-carpal 4.
Semi-carpal and
Time
okay.
up.
Time up. Okay, I'll give you 20 plus 20. Semi-carpal plus 20 for that question. Okay, total, ma'am. Etna correct? 5 correct and 2 wrong. Okay. Therefore, 80, ma'am. 80 points. 5 correct and 2 wrong. 80 points. Okay. Set 2. Who's having set 2? Team 6. Shall we start? Okay. Time up. Time starts now. Expand LSD.
Sir, listerik acid ayithila madam. Sir, listerik acid ayithila madam.
சத்தமாக சொல்லு, கேட்கல. டைம் அது சொல்லு.
Listerik acid.
Okay, wrong answer. -10. Pathognomic sign in antemortem drowning.
Cadaveric spasm.
Correct answer. +20. Hitler's law deals with dash bone.
Sternum.
Correct answer. +20. Bruises are medically significant than abrasions. True or false?
False.
Correct. +20. What causes chalcosis?
Fluorine.
Negative. -10. Barber's test detects
Seminal fluid.
Be specific.
1 minute more.
Be specific. Which?
Spermine.
What?
Spermine.
Yeah, correct. Plus 20. Fusion of lower end of ulna occurs at?
16 to 18. 16. It was 17.
What?
16 to 18.
Wrong answer. 17 to 18. In throttling, there is dash fracture of hyoid bone.
Invert fracture.
Okay, correct answer. Plus 20. Arsenic poison mimics.
All wrong.
30 seconds
Plus
more.
20. Ganja contains dash percent of THC. Tetrahydrocannabinol. Can go back to any of the questions also if you don't know this. You want to go back to the previous slide?
Time up.
Time up. Ma'am. 6 correct and 3 wrong. 90 points. 90 points. Set 3. Who is having? Set 3. 3. Sandosh. முடிஞ்சிரும். Shall we start? Time starts now. Expand MDMA.
Methylene diamine methamphetamine.
Methylene?
Methylene diamine methamphetamine.
Wrong answer. Minus 10. What is Bobbitt syndrome? Can pass it. Active principle of Nux vomica.
Strychnine.
And okay. And one more answer is there. Okay, plus 20. Body of offenses.
Pass.
What is quartered? What is quartered?
Pass.
Pass. Suicidal incised wounds shows hesitation cuts. True or false?
True.
Okay, correct. Plus 20. What is a sear? Sear.
Pass.
Base occiput
minute
fuses
more.
with base occiput fuses with base sphenoid at age.
Pass.
Common source of bleed for SDH is?
Bridging veins. Emissary veins.
Okay, plus 20. Megentrus is?
Stomach lining of
Be specific.
sir, mucosal lining of
What?
30 seconds more.
Which occurs? Be specific. You want to go back to other questions? Previous slides. Bobbitt syndrome, body of offense, quartered, these and all you have to answer.
Time up.
Sear, time up. 3 correct and 1 wrong, therefore 50 points. 50 points. Set 4. Shall we start? Okay, time starts now. Expand Tohota. Time is going. Can pass the question.
Okay, pass.
Common source for bleed for SAHs. Active principle for conium maculatum is? What is bagging?
Putting a like plastic.
You have answered. Putting a plastic bag over a face.
Over the face and
Minus 10. Okay, sodium fluoride is preservative for blood in alcohol estimation. True or false?
One minute more.
next is
Caliber of a rifle firearm is?
it's a caliber.
Treatment for cafe coronary is
It's a vagal injury.
basophilic stippling is seen in which poisoning? Pass சொன்னீங்கன்னா போலாம் அடுத்த கொஸ்டின் அது.
Lead poisoning.
30 seconds more.
Correct. Plus 20. And secrete.
Next question.
Next. Medullary index is more in animal or human hair?
Animal.
Plus 20.
Sir,
Want to answer?
Tota.
Tota, சொல்லுங்க.
Tissue organ human organ transplantation act.
Correct. First ல
Time up.
Tissue organ and human.
Sorry, minus 10.
Sir, time up.
Minus 10. 2 correct and 2 wrong. Therefore, 20 points. 20 points. Set 5. Okay, shall we start? Time starts now. Expand JJB.
Juvenile Justice Board.
Correct, plus 20. Binomial name for saw-scaled viper. Sir, क्या कहा sir? Binomial name for saw-scaled viper.
Bungarus caroleus.
Sorry, minus 10. Who is the father of ballistics? Pass, sir. Taboo, sir. Be specific.
Vargas.
அதில் சொல்லிட்டீங்க சரியா? Okay, let's see. Most reliable method of alcohol estimation is?
Pass.
What is a Spanish fly?
Canthrites.
Plus 20. Narcoanalysis is not admissible as evidence in court in India. True or false?
1 minute more.
True.
Correct, plus 20. What is croak?
Pass.
Sciatic notch index helps in identifying dash.
Male or female, sex determination.
Correct. Jefferson fracture occurs in? Correct, 9th question, plus 20.
Seconds more.
Specific.
What? Which one? Tabun. Yeah, correct. Plus 20.
Okay.
OPC. Tabun is OPC.
Most
Plus 20. Nerve gas. Croak. Jefferson.
Time up.
Okay, ma'am. 5 correct and 1 wrong. 90 points. Set 6. Sir, Mike. 200 points. Last team. First vara mudiyum. Okay, shall we start? Time starts now. Expand RFLP. If you don't know, you can pass it.
So next pass.
Conduct money is given in criminal cases. True or false?
False.
Correct. Plus 20. Bite mark is what type of operation?
Pressure abrasion.
Correct. Plus 20. What is space ball? Space ball. Space ball.
Pass.
Venom glands or modified dash glands in snakes.
Sebaceous glands. Sebaceous glands.
Wrong. Minus 10. Taurodontism is classically associated with which race?
Mongoloids.
Correct. Plus 20. In stab wound, spindle shaped wound indicates dash type of weapon.
1 minute more.
In stab wound, spindle shaped.
Double-edged.
Correct. Plus 20. Gettler's test uses.
Chloride ions.
Plus 20. Fingerprint Bureau was first established in which?
Kolkata. Kolkata.
Okay, Calcutta. Correct answer. Malignant symptoms occurs in-
Cocaine. Cocaine, sir.
Correct.
Sir.
Which one? Space ball.
30 seconds more.
RFLP. Space ball. RFLP. Space ball.
Ten seconds more. Time up.
Time up. Okay. 7 correct and 1 wrong. Therefore, 130 points. 130 points. Okay. We'll calculate the scores. This ends the PG quiz finals. Thank you, Thanjavur sir, for the opportunity. Thank you, Gopi sir and Uday Banu ma'am for all the helps. And Gopi sir is the main pinning.
Next, they scored 175. And the third place goes to Hemorrhagic Hustlers. They scored 160. And the fourth place goes to Lividity League. They scored 110. And the fifth place, Medico-Legal Mavericks, they scored 100. And the Cyanide Circle, they scored 45, the sixth place.
I request Dr. Arulmati Kannan sir to felicitate our quiz master, Dr. Narendra sir. I request Arulmati Kannan sir to felicitate our quiz master, Dr. Gopinath sir.